Hello, and welcome to the review for the 6 weeks non-weight-bearing protocol. My name is Sam McBride, Dr. Ellis' physician assistant. This overview is to act as a guide and reference for your post-operative recovery, in which you will not be allowed to put weight on your foot and ankle for a total of 6 weeks. It is important to follow this protocol as to allow for proper healing of your surgery, as well as a smooth recovery. If you have any questions as the presentation moves along, please write them down so that we can go over them at your next visit. Otherwise, let us continue with the presentation. At the end of your surgery, you'll be placed in a postoperative splint. This is similar to a cast, but is open in the front, made of plaster, and has ACE wraps holding it together on the outside. For the first 2 weeks after surgery, there are mainly 3 simple rules. Rule 1 is to remain non-weight bearing. Rule 2 is to keep the foot elevated 80 to 90% of the time, getting up occasionally to go to the bathroom or other small activities to reduce the risk of a blood clot. This will help you with normal wound healing, as your incisions will be under less tension. More importantly, it will help dramatically with pain control, since increased swelling will directly increase your pain. You will notice that when the foot is down, the foot and leg will hurt, pulsate, and turn red or even purple. Rule 3 is to keep the splint clean and dry, especially in the shower. You may use a commercially available cast cover, otherwise what works well is using a garbage bag and sealing the top with saran wrap and duct tape. Keep in mind that although you are allowed to shower, you are still not allowed to put any weight on the foot. A shower chair can help and make showering more safe. The office can give you prescriptions for all of these items. Your first postoperative visit will be roughly 2 weeks after surgery and will likely be conducted by me. At this point, your splint and sutures will be taken out and you will be placed in a cam walking boot. This is the boot you will eventually use to transition your weight, although for now it is simply acting as a removable cast that you will need to keep on for most of the day, especially to sleep at night. We will have you come out of the boot a couple times a day for simple range of motion exercises and to shower. Otherwise, it is very important to stay in the boot. You will still be non-weight bearing at this point. We will also discuss plans for physical therapy, since physical therapy offices are generally booked a couple weeks in advance. You will not, however, start physical therapy until after your next postoperative visit. For your 6-week postoperative visit, we will now get a set of x-rays. This is also when you will begin to transition your weight with your boot. This transition from partial weight to full weight is described in detail in the other presentation listed. In summary, you will make the transition to full weight over 4 weeks in the boot. After you complete this transition, you will then progress out of your walking boot and into a sneaker over another 2 weeks. You should also start physical therapy shortly after this visit. The complete process takes a total of 6 weeks, which will bring you to roughly 3 months mark from surgery, at which point you will be seen for your third postoperative visit. This next slide simply describes the different restrictions in both driving and travel by plane. It is covered in more detail on the partial weight-bearing presentation listed separately. You are now 3 months out of surgery. The goal at this point is to be fully weight-bearing in a sneaker and able to do some light walking. At this visit, we will get new x-rays. We will also discuss continuing physical therapy, as well as give you the green light to advance to non-impact activities such as stationary bike or swimming. We will hold off on advancing you to higher levels of impact activities such as jogging and running until you are reevaluated at your next postoperative visit in 3 months. During these next 3 months, you want to focus on continuing with strengthening and conditioning the foot and ankle, as well as the leg as a whole, so that you will be ready to advance your activities after your next visit. In addition, you will still need to wear relatively wide and supportive shoes that accommodate swelling, which is very normal. This commonly means a sneaker. You are now 6 months out of surgery. During the visit, we will get a final set of x-rays. At this point, if all is going well, we will allow you to transition into impact activities and then finally sports. In addition, you will be able to advance to all shoe wear as tolerated. No other postoperative visits are required beyond this point, although would continue to follow up with you if needed.